Hello everyone, I am Vandana Sinha and I am an occupational therapist at PlayStreet Especially Able Educare Trust, Bangalore. PlayStreet is an organization that provides educational services to help the child with special needs become independent and live up to their potential. We offer parent empowerment programs and integrated schooling programs and a variety of clinical services. As April is Autism Awareness and Acceptance Month, we wanted to bring you the pioneer in the field of autism to guide us all and spread more awareness and knowledge. Today is our 13th talk, and our fantastic speaker for today is Miss Richa Kapoor. Ms. Richa Kapoor is an occupational therapist who has a vast experience in the handling children with various developmental disorders from preterm age to adulthood. She is the founder director of Sensitivity, Early Intervention and Child Skill Enhancement Clinic. She is also the founder and director of Nurturing Path Clinic, Gurugram. Ms. Richa consults with the different hospitals and schools in New Delhi and has developed learning center team to help children with special needs. She is an international trainer for Handwriting Without Tears USA curriculum. She is certified sensory integration specialist for assessment and management from University of Southern California. She is certified in sensory enrichment therapy, MNRI, also Brain Gym 101. Ms. Richa Kapoor selected by IIM Bangalore for Goldman Sachs Women Entrepreneurship Program. And today she is talking about Handwriting Without Tears Program for children with autism. And thank you, Ms. Richa, for agreeing to join us for PlayStreet Autism Hour today. We are honored to have you here. Hope you are doing well. Would you like to say a word to our viewer?
Thank you so much for having me over. It's a pleasure joining in with PlayStreet and the talented team that all of you are. I hope I'm able to give some glimpse of the Handwriting Without Tears program and how it helps our children on the autism spectrum. So glad to be here. Thanks again, and wonderful initiative. We can go ahead.
Thank you, ma'am, again. And I would like to start with my first question. Why handwriting is so important to teach our children? And what age of children benefit from the handwriting trainings?
So, well, handwriting from centuries now is one of the most important skills, one of the building blocks of literacy. And we've known our scriptures written, and how creative thinking comes to picture is through handwriting. And therefore, it is one of the skills, an important cognitive automaticity has to develop through it. So handwriting is definitely an important skill, generally speaking, for our population. And as far as the age for training is concerned, if you're talking about typical population, pre-writing skills start anywhere after 1.5 years, when the hand functions start becoming more finer and we have in-hand manipulations. And a lot of that with advancement of the brain and visual perception skills. So all that starts working on the pre-writing arena. And if we talk about our children with development delays, then there is no end. There will be stages and stages wherein writing may happen at any age and stage.
Great, thank you, ma'am. Today we are talking about the Handwriting Without Tears program, and name is very impressive. So I would like to know, and our audience like to know, what is Handwriting Without Tears program and how it is different from the other handwriting programs?
So, well, I've had the honor of staying and learning from the founder of Handwriting Without Tears, Jan Olson, senior occupational therapist with more than 50 years of experience in Washington, D.C. So Handwriting Without Tears developed with her own son facing handwriting difficulties. And while trying to help him, and slowly the other kids in the school were referred to her for handwriting issues. So she developed over the years this whole curriculum, and into a very structured, joyful, graded pattern, and called it Handwriting Without Tears, that it shouldn't happen to somebody with tears. It is a joyful program, and hence this skill in children should come happily to them. So this is where this program started. Though there are many other handwriting protocols as well, what stands Handwriting Without Tears apart is its blend of overall learning. Now, lately, in the last 3-4 years, Handwriting Without Tears has become Learning Without Tears, and it has got embedded with reading, pre-readiness skills, pre-reading skills, maths, phonics, and keyboarding. So it is now a wholesome curriculum targeting all areas of learning in children. And the core areas with which Jan Olsen started have now expanded with much more multisensory and digital technology. So this is one program which has such a wide variety of plethora of activities and books and manipulatives, with a lot of OT's knowledge of handwriting that blends in it, and it matches both for mainstream as well as for children with development delays. And that is where it stands apart from other handwriting curriculums.
Thank you, ma'am, for giving a more idea about this program. Also, as this program says that without tear, handwriting should not be with the tear. So yes. Why do children with autism find handwriting very tough? And I will extend my question. Is this program suitable for the children with autism? Until what grade children can benefit from this program?
So now, blending autism and handwriting, we all who are in the field and handling children with autism, we know there are certain areas which are working slightly differently in our children. Their body tone, the visual perception, the ability to focus more on certain parts of a activity rather than the whole. Those are subtle areas which make handwriting difficult for children on the autism spectrum. Handwriting is a big science in itself. I mean, to think of it, in India, we are so, as any literate urban population, is so obsessed with their children writing that the moment they are one, they're already giving them a tool to scribble and write. Whereas if you imagine that a photo of an alphabet A has to be in the brain, the child has to retrieve that picture, the hand has to move in that control in the right fashion, there has to be a sequence to making those strokes, and that is called A. That A falls as the first letter in the word apple. What I'm talking, every step has a whole lot of cognitive function behind it. So underlining and understanding our children on the autism spectrum, it does become a little struggle for them if the right approach and right understanding is not given to them. So unfortunately, sometimes stepping on the fifth step and not going through the initial stepping stones actually creates a chaos in the child's mind, and there is not a relationship that the child develops with the writing tool or with the paper, and years go by in understanding and doing different things. One person might say, oh, the grip isn't as good, so let's work on grip. Okay, maybe visual perception is not as good, let me work on that. So when the chunks of things are taken separately, combining them is what gets missed, and children struggle. Many research studies have also shown that compared to the mainstream children, what struggles basically children with the autism differ in their handwriting are the formation, the pacing, and the motor control. Not about the speed, the legibility. Those factors were not as much a difference, but the three factors that I mentioned earlier. So this is where we understand that how it is a little different for children on the autism spectrum and why most of them struggle with the handwriting.
Okay, and by what grade we can teach this handwriting without tear program?
Well, as I said, handwriting without tears technically is a protocol starting from pre-kindergarten, which could be 2 to 3 years, up till 5th, 6th grade officially. But since children on the spectrum may not be going grade wise every year. So it's a curriculum even adolescents on the spectrum can be taught and very effectively giving results. I use this protocol even with adults who are struggling with handwriting and issues with, say, again, handwriting, we have different issues: copying from a distance, copying from the screen these days, copying from the book, or writing from your ideation. So sometimes some adults on the autism spectrum have difficulty when their ideas, they're not able to bring them to paper. And that's what is the whole role of writing, that I'm able to put my thoughts on the paper and I can communicate it with people who would read them. So when this gap doesn't exist, I still use this program with even the adults. So this is how it can be used, modified with any age group on children on the autism spectrum. But because it is also used in many mainstream schools for mainstream population, it starts from pre-kindergarten up to 5th grade.
Okay, so I'll just summarize it. Please correct me if I understood it correctly. Yes. For children with the autism, we need to should not go by the age. We should assess the children where the child is, and then we'll start program from there. And we can take it to the adolescent age also. Okay, and yes, it is from the pre-garnet till grade 5, the normal curriculum is. Correct, ma'am?
But one unique part is, I'll show you this is one of the Handwriting Without Tears book. Though it says my first school book or another book, none of the books have any grades written on them. And that is the core area, that even if in a mainstream classroom or an inclusive classroom, one child is a year behind from his peers, is only the color of the book differs. Nobody comes and says, oh, you're in 2nd grade, but you're doing the 1st grade book, because they don't mention grades on the books. It's for the therapists and educators understanding that we follow the structured curriculum.
Correct, ma'am. Yeah. So, ma'am, when we assess a child, and as an occupational therapist, we look at, okay, handwriting, we should start now. So what are those prerequisite skills we should find that it should be mandatory before to start the handwriting training? How we can identify those skills?
So handwriting readiness is, again, a huge subject. If I'm talking about children on the autism spectrum, there are certain prerequisites before I can make the child sit on the table chair and start guiding him on specific handwriting instruction. Those readiness are, of course, self-awareness, environmental awareness, the awareness, the sensory integration, and a good motor planning to be able to imitate. Most important is the print awareness. What is print awareness? That I, as a child, understand that something written has a meaning. If I am a child and I have been taken to a mall or a shopping area with my mom, and my mom reads, okay, these are vegetables, these are fruits. So I should be able to correlate that fact that something written there was what my mom did. Or my mom carried a list of her shopping and she's checking, and I know something there makes it is a story or has a meaning. If I, as a parent, read to my child on the autism spectrum, and then if I'm showing a book with pictures and a line, the child is able to interpret that the pictures make something, but the written script is something that is readable and is what my mom is telling me. Now, this is called print awareness in various forms. And once a child reaches these stages is where we assume that the child has handwriting readiness. Of course, the other technical parameters of good visual motor integration, good visual perception skills, eye-hand coordination, knowing alphabetic principle. What is alphabetic principle again? That a symbol like A, it has a sound, has a language. So these are the prerequisites which should be worked upon prior to starting structured handwriting training and making the child to be able to start writing. For example, many places, schools, therapists, and even parents, the moment it's 3 years, and they 3 years school admission has to happen. And now my child should at least know standing line, sleeping line, whatever in India we mostly kind of do. But if the child was not exposed to print awareness, except the child didn't have environmental awareness, a postural readiness, or the alphabetic principle, for example, then doing something which didn't make meaning to him is what is gone wrong. And repeated over a period of months or years, there is a total disconnect. And then we assume, oh, now the child is 6, the child cannot still make uppercase or lowercase, and the whole scenario has gone for a toss. So these are very, very important prerequisites before starting handwriting training. And all people associated with children, when the handwriting bit starts, should be aware of this and work on these parameters, whether it takes a couple of months or a year. And you will see better results happening once these have been achieved.
True, very true, said ma'am. Okay, so next question is, when we talk about the handwriting training, we start from looking at the posture and the other proximal stability also. So can you explain what is the importance of posture in handwriting training? And also please explain to our parents about the pencil grips for the handwriting. Because usually we say that tripod grip, children should achieve the tripod grip and then should start writing. So please explain about the importance of the posture and what is the importance of the different pencil grips to our parents.
Right. So posture, as I previously also mentioned, is a very important factor generally for handwriting again. And as OTs, we all know, we talk about the correct posture, the proximal stability, the trunk control, the movement from the elbow or the movement at the wrist. So these are all small factors that we look into. The correct posture, generally to speak, is the right size of the chair and table, where the hand is slightly, the elbow is slightly flexed more than 90 degrees, and there is wrist extension. The hip, knee, ankle is at a 90-degree ratio on all the 3 joints. And once the child has that kind of stability, it is considered a very ready motor aspect of handwriting. So as we know, most of our children on the spectrum have low body tone. And so therefore, sometimes they're slouching, they may have certain reflex non-integrated in them, and therefore there may be some shoulder extension. And therefore, so once the core or the proximal stability is not there, the writing tool at the hand doesn't function nicely. So we ought to work a lot on trunk stability, a lot on flexor positioning. So providing the right size of chair and table is a very simple way to bring things together. We know because of the low tone, there may be inappropriate proprioceptive feedback. So what we recommend is that we do give wooden chairs, the hard wooden chairs, to children. So the feedback to their proprioceptors makes them sit upright as much as possible. The chair with a plastic or a bean bag or those kind of lesser providing proprioceptive input devices may make the child tilt to one side, slouch downwards. So those may not give us the output that we want. So this is what we do centrally. And in OT, we know we do a lot of vestibular proprioceptive input, and that goes a long way in handwriting. Even so, for example, in children, when we test them, children in autism, we test them on SIPT, they have a lesser post-rotatory nystagmus, which indicates there is a vestibular nuclei effect. Hence, providing a good vestibular input, maybe before a sitting activity, to enhance a posture is one example, which as OTs, we do recommend to bring about the postural deviation, if at all. So when you look at the whole picture, when you identify that this child just slouches, goes inside the table, wants to sit in a corner, and I understand what's going on, whether it is his, is he able to keep himself upright for a long time? Is he able to sustain a certain posture in other activities? It's not just on the tabletop. Then you may also check in upright activities, in other animal walks. So a lot of that has to go on to be able to have the whole picture. And accordingly, we plan to bring about the postural stability. Once the core and the proximity is worked upon, we come to the distal aspect and comes the grip. So technically speaking, we all talk about the tripod grip as the the hallmark of bringing about a good handwriting. And say, if I assume what is a tripod grip, wherein the thumb, the index, and the middle finger hold the device in such a way that it flows. Uh, well, definitely this is one of the most functional grips, but this is not entirely required to become a good writer. And when, say, for example, you have a child who's been writing for 2 years with a modified tripod grip, a quadruped, or another thumb tuck, different grips, but you see a functional writing, you see there is no deficit in terms of formations, legibility, pacing, but there is an awkward grip, we might not change. It is fine to have an awkward grip as far as the functionality of handwriting is greatly there. Handwriting Without Tears definitely focuses a lot on therapist guided structured instruction for grip, and it does it very joyfully. For example, there are techniques wherein I may say to the child, pick up the pencil, pick up the pencil, this is easy to do, my thumb is bent, pointer points to the tip, tall man uses its side, and I take the pencil up and drop it at the side, and then I pick it up again. So a couple of practices like this with the rhyme that focuses on it on a couple of times works on very structured grip instruction. Another strategy, you face the pencil, the pointed part away, pick it up from where the shaving meets the paint, use your 2 fingers, flip it, and then give the grip and drop the moment the grip starts losing its hold. So when you do this pick and drop, the right motor pattern establishes in the brain. Another way to say it, pick up the baby. So when I do this, what will say, pick up the baby, put it to bed, give it a pillow for its head. So you need to see what works for the child. What is the child's connect with, which of your rhyme or which of your phrase that he or she may connect with. And therefore working specifically on the grip is a very important aspect. It's not to be assumed that children are born with the tripod grip. It has to be taught. It has to be explicitly given the right instruction, worked on for some time. Each child different and unique, and accordingly grip has to be developed. Handwriting Without Tears also initially works with a lot of these little sponge pieces, which when worked on a slate, work on the grip. So there are many manipulatives that simultaneously, when we're working with the manipulative, enhance the tripod grip, which is the functional grip, but a quadruped also works. And as I said, a child coming later with an adapted grip, but functional handwriting need not be touched.
Yes, great. So posture and proximal stability, as ma'am is saying, one of the very important component in the handwriting training. And also we should look at the functional grip of the children until and unless it is not giving any pain and discomfort to the child.
Absolutely.
Okay, thank you, ma'am.
Thank you.
Okay, so our next question, ma'am, is just related to that only. So many of the children is not able to sit for the handwriting activities because of maybe they have a lot of sensory issues also. And usually the parents and the professional thinks that handwriting should be done in the sitting position. So
right.
Is the handwriting without tear can be implemented for those children who has a poor sitting endurance and also the sensory difficulties? How we can do that?
So, of course, in our previous questions, when we said that readiness does involve the sitting tolerance and the ability to sustain attention on a tabletop task, which are some prerequisites for handwriting. But definitely we have to address and respect the fact that our children on the autism may have some sensory challenges, or they may not be as able to sustain their sitting capacity. A lot of our activities are embedded in Handwriting Without Tears, which can be used as movement breaks, or which are movement breaks working on handwriting. So for example, we have these 4 wooden pieces that are the core, which we call the big line, the little line, big curve, and little curve. So when I see my child's sitting tolerance is, say, for example, 5 to 7 minutes, and I know that is what I will get. And so before the child starts squirming and kind of, is about to, so okay, movement time. So I start with my maybe the two big lines, and we could do tap, tap, tap big lines, tap them all together. For example, one of these, we could stand and do, you need to know the child's interest. So you're compensating the child's erratic movement or unstructured roaming around in the room with your some embedded structured activity through one of the manipulatives, or maybe doing an air writing on the door by imagining that we're doing something, a large kinesthetic movement, imitating an alphabet formation or a pre-writing pattern could be one part of it. So those could be for children who may not sustain sitting as much. And therefore, when I know, okay, I've given again a 5-7 minutes of movement break, next we're coming back on our table and maybe continuing to do some of our tabletop tasks. Children with sensory challenges, we need to respect and understand what kind of sensory challenge, whether it is an auditory defensiveness to maybe the noise in the next classroom or next room. Is it holding the pencil that is a sensory challenge? He may not want to hold it in the hand, which is tactile. It could be any other, so proprioceptive, it is kind of just the tool is falling again and again. So I need to really first understand which sensory challenge or which sensory component is hindering the child's capacity to write, and working on either the compensatory strategies, giving accommodation for that sensory, or working prior to that sensory component, giving some integration does really help. So a therapist with a strong understanding of the curriculum, strong understanding of the child, matching the two uniquely, prioritizing the child's behavior, of course, which is more important, has to blend in the whole thing to deliver the outcomes. And this is where, when I say I respect the child's sensory needs, I respect the fact that yet the sitting tolerance is not as much. And my deliverable in terms of bringing him to some handwriting or writing concept is what the whole ideation. You will really do well in the whole session.
Great, beautifully explained, ma'am. Thank you.
Thank
So
you.
when we're talking about the Handwriting Without Tears program, can you explain to our parents what are the few important components of the handwriting program? Like we have heard that it's a multisensory program, and this program uses the 2-line system. Not in the usual curriculum has the 4-line, and in Hindi it's a 5 lines. So why it is important to use the 2-line system for writing?
So Jan Olson used to very popularly explain this, that imagine as a new driver, if you've just learned to drive and you are left in a 4-lane drive to manipulate on a highway with busy traffic, what are you gonna do? Probably have an accident or jam your car in one of the side rails. And if you are in a single lane driving, you are more in control. So what happens is, I'll just show, Handwriting Without Tears definitely emphasizes the 2-line protocol. We have this double-line blackboard here. Now, the baseline, this is the bottom line, which is called the baseline, and this is called the midline. It clearly divides the alphabet into 3 parts. The baseline gives the placement to the alphabet, and this above midline gives the motor control, gives the control to the alphabet. So for example, if I have the word alpha, and if I know this is how it will be written, and this is my baseline here, I know I have to stop here. And had it been those blue or pink lines in the middle, and as a child on the spectrum, I look at the small parts. I might stop here. I may not know what has to happen. I'll go down. This is what I have been taught. And now this bottom line, the baseline has given me a base to know that I stop here. This controls the size of the alphabets. So now the alphabets are divided into 3 components. The tall, which go above the above line, the midline, the middle alphabets which stay between the two lines, and the descending alphabet. The descending portion comes below here. So now when I'm able to specifically divide using the two lines, I will not have instability, where if I had a 4-line or a 5-line pattern, I may float my alphabets here or there. And as a child with difficulty in some visual perception, I might have a floating alphabet or word formation. So how a double line may give a clarity vis-a-vis a 4-5 dotted line pattern is much more clear, and research has proven this to be much more effective for all children initially, and then the generalization can be done as per the school requirement. So this is what happens with the double line and why it is important to be used.
Yeah. Also, please explain to our parents about the multisensory approach.
Well, it is the core of Handwriting Without Tears is the multisensory approach. All the manipulatives that in the initial years Handwriting Without Tears recommends, the wood pieces, the magnetic slate, the blue mat. We use this small slate and we use the technique wet, dry, dry. All these are various multisensory methods with a lot of joyful singing, visual connect that is recommended with multisensory approach. What we believe is that once all the senses, the visual, auditory, tactile, proprioceptive, work in sync, and in the early years when a child is given a lot of opportunity to use these wood pieces, for example, or one of the manipulators, when I I want the child to feel the curve with eyes closed, and the tactile sense, the proprioceptive, I can feel the shape. This is some curve. It has a name. It is called C, or it could be two of them, and I could make a circle. I could. This is also O. So this is giving me a tactile input as well as the proprioceptive. And then when I sang with it, tap, 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 big lines. Now this tapping, this movement has a sensory component. All the manipulatives has a smiley face on the top left, which works as a visual reminder to every child though, but works very well for children on the spectrum to look at the point. You would see here, even on the slate, it is this top smiley to indicate that English writing happens top to down, left to right. So in one of the workbooks, it will be very categorically described using the wood pieces. First, we start with that. Once a child is able to, so these wood pieces construct the entire alphabet series. And we start making them on a blue mat, which again, the research has shown that when I create an alphabet on the blue mat, I start, okay, big line down, big curve, it is D. Now this mapping in the brain kind of imprints the alphabet formation. It prevents reversals. It is visually, the child has constructed it. So what we later identify as constructional apraxia, so we are working on all this through multisensory ways in the starting stages. So as I was showing you, it starts with the wood piece formations on the blue mat, and then we practice the same on the slate. I give the same instructions. What's unique here is I am not saying, okay, make a sleeping line, then make a curved line, and then a slanting line to make R. I will have a very structured standard language, big line, little curve, little line. I even say this, a child on the autism spectrum will tell me, ma'am, it's R. And yes, it is. So we do a wet, dry, try. I make the alphabet R here. I give the little sponge, which I dip it in water, to trace on it with the wet sponge, then with a dry tissue or a dry sponge, and then try with the chalk. So when the child has gone through these multiple sensory stages of constructing an alphabet, then we reach the book and we only give the gray shaded patterns to copy what you did. You built through the wood pieces, then you did it on the slate. There are other preliminaries, there are magnetic slates, there is roller door, there are we do it through air tracing. So a couple of multisensory stages are given before the child reaches a book and uses a crayon or a pencil. And we do not use dotted patterns. As I said, children on the autism spectrum look at the small parts separately. So they get so stuck up with joining the little dots that are given in many of the workbooks and worksheets that we all use, that the whole picture, that if this alphabet is Q, by probably giving a gray shade, is giving the sense of wholeness to the child, and the child does not get stuck with small patterns. And this is why every page on a workbook is very very thoughtfully planned and has a purpose, will have some visual perception, auditory, tactile input to it, supplemented with, of course, or every few pages there's a rhyme to supplement, so that it kind of, where do you start your letters, from the top. So this is where, if a child has started a formation wrong, so writing A from bottom to up, I may not say, oh no, write down top to down. But if I say, where do you start your letters, from the top? So this joyful correction versus, no, 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 you have to know, you have to start from the top, look at the dot. Child doesn't want to do it sometimes because it's a lot of instruction. And sometimes we use the language very easily. What is a top? What is a bottom? And the child may not even know that. So did I blend, did I work on the concept of what a top is, what a middle is, and what a bottom is separately, and then blend it all? So this is where a lot of multisensory techniques are embedded in the curriculum, and it is the core of the whole outcome that our children get from it.
Thank you, ma'am. So we know the importance of multisensory learning here. Okay.
Yeah.
And if we have a child, and many children with the autism also, they doesn't want to write. There is no motivation for the writing. So how the Handwriting Without Tears program can help these children, or any alternate way to help them?
So, well, it's very easily said, and we just assume, oh, the child is not motivated to write, he doesn't want to write. And after trying for months, there comes a stage where, you feel, what? It's just not seeming to work. Before that stage, let's understand, how does motivation come to anyone, to us? So motivation is either out of curiosity. I would, want to know more. There is that inner drive to know more. Or it comes with a sense of achievement. If I've done well a little bit, I want to do more because I get recognition, I get applause. And so somewhere I feel curiosity and appreciation are two very important factors to build on motivation of any child. And before kind of reaching that stage where we, put, okay, the child is not really motivated and may not write, I have to go through these stages of small achievements, even if a little achievement happened over a period of month, it is there, it might happen later. So there has to be a very strong parent connect, that whatever a therapist does, whatever knowledge a therapist has to be very strongly linked for home. So Handwriting Without Tears has a lot of, now with digitalization, of course, there is a lot of home blend ideas and programs that the child can practice at home. The Wet Dry Try is an app, in fact, not just a physical slate. The child could also practice it on an app. There are great digital ways which the child can learn to write. If you explore the website, a lot of that material is freely available. And because we know screen time and how and why it is has a bad name, but it can be utilized in a very small, timely, finer way to work on the right strategies. So those are a couple of techniques that the parent could use. If there is always a good home and therapist and school connection, there will be motivation happening in the right approach when we are all on the same page. But yes, maybe a few children on the autism spectrum may not write, and which is where we need to move and use other technologies. Now, technology has everything. There is speech to text, there is typing, there is now we use the screen touch. So all that can be used and trained. And so in that scenario, emphasizing reading and comprehension becomes one of your primary goals, to be for any child to be able to use technology. It is very easily said that we could, maybe we start teaching the child to type or to use uh, a digital speech to text connect, but there has to be a basic level of comprehension and reading, and we all should know reading and writing go hand in hand. So so if that writing bit is not happening, how much have I worked on the reading aspect? Initially, when I spoke about print awareness or alphabetic principle, this is where reading would have happened parallel. And now if that aspect is, the writing aspect is going a little slow, I emphasize writing. Handwriting Without Tears now has a keyboarding without tears curriculum, which works for children who would now keyboard. Of course, the writing importance has kind of reduced in the recent years. We're all typing a lot, but can you imagine the importance of writing when I'm trying to write on a paper vis-a-vis what I'm trying to type? We know a lot of our cognitive functions are separately being used. A student in a college taking notes and writing down vis-a-vis a student maybe just recording or typing will be able to comprehend and memorize it better when they have handwritten. If I'm a creative writer and I was writing something and I made a mistake, I cut it off and I moved on to the next line, if at all I wanted to use one of my ideations, I could check what was I cutting, what did I draw. But on a typing thing, that's deleted and it's gone. So there are a lot of connotations that are of an advantage when it comes to writing, but one should be open and justifiably using or moving on from writing to technology and replacing with the right apps or digital ways of communicating, which becomes the core when we work on children on the autism spectrum, that if they're able to communicate their thoughts even through typing. Now there are apps which probably even interpret your emotions through text, and that has opened up a plethora of good options for our children. So using them at the right stage is also definitely recommended.
Thank you, ma'am. So we got the one info that now this program is available on the app also, right?
Yes,
ma'am?
yes, yes. It
Great. Okay, thank you, ma'am. And my next question is related to some skills, because many children has the poor visual perception skills, poor working memory, poor ideation or motor planning. And so how we can help these children? If the children with, sometimes with the children with autism also has difficulty in performing the writing activity because of these poor skills. So how we can help these children?
So all that we've spoken in parts has worked on identifying the right skill that is blocking the achievement, or even working it separately. For example, when you said ideation, when you talk about working memory, these are all various skills that through our curriculum can be implemented. So for example, when I do a sorting activity with my wood pieces, I'm trying to, I put them in a bag, I'm asking the child to take out the big curve. So I'm also working on stereognosis there. So there are those skills with a good mindset, and somewhere there is behind it a connect with literacy, with the ability to comprehend the instruction. And there is an okay, now your turn to tell me, what do we play with these wood pieces? So I have seen creatively and imaginatively children building out different things using these wood pieces. It was a joy. In one of my researches, I spread the wood pieces to a group of 8-10 children, and we were just observing them what's happening. One of them like built a teacup and brought it to me. This is the teacup, and I was so amused at how ideation and creativity could be worked. A child built a boat or an aeroplane, and they were all children on the autism spectrum. And so how at a young age, probably the drawing skills, we know they're also good at art, they are keen visual learners. So it definitely enhances these core skills, which may or may not be required for writing, but are life skills for a lot of learning in life. So, and using them, or then, replicating it with simple toys, simple things in the house, can work on all the skills that we are talking about.
Okay, thank you, ma'am. And now I would like to ask something about the school. As you mentioned that Handwriting Without Tear program is happening in many schools. So how this program support the school curriculum, especially in India, where we know the different schools has the different curriculum. And
Right.
nowadays also they started teaching the small letters, lowercase letters first,
Hmm.
than uppercase letters. So how this program blended in the school curriculums?
So we did a pilot study in a couple of schools in India to establish how handwriting without tears could be embedded, or how is it different, and how in uh, if I would not even talk about handwriting without tears, there is no uniformity even in schools for mainstream children vis-a-vis handwriting. There is none of the teaching programs, say the B.Ed or the M.Ed, even to a good teacher, does not talk about how handwriting develops. Mostly, the regular school teachers know if a child has bad handwriting, giving them a cursive book for holiday homework and doing 10 pages each day is a kind of practice that will perhaps improve their handwriting. This is what maximally educators and teachers in schools are aware of. So when we do not have that uniformity within a city in India, we can't talk about how it is being implemented for everybody, whether children with developmental issues or mainstream children. So we know developmentally, people in the field, that research shows that capitals have to be taught first before the lowercase. It's a very simple thing to understand. You're in a cinema hall and there is an emergency. Will the exit be written in lowercase alphabets, or I mean the capitals, the EXIT that's visible to you, and you know that's the emergency and you need to rush out. So the brain perception for capitals comes first and then the lowercase. So we have had a couple of struggles in my city here where, say in the last 10 years or so, I have been recommending to schools to not start with lowercase or not start immediately with cursive, and good acceptance has happened, and slowly a change is coming. But of course, reaching everywhere is may not happen. Therefore, handwriting without tears, every workbook, different years, has a lot of generalization activities where, say, for example, if we teach a double-lined thing, when the child masters the double-lined protocol, there will be generalization pages where maybe a couple of pages will now blend with 3 or 4 lined pages, so the child can replicate that learning too. There are separate sheets available, which are distance wise, graded. When the child starts writing bigger alphabets, how their size can be reduced, how the spacing can be taught. Cursive is only print connected. We're not getting into the artistic cursive. So those are the things which Handwriting Without Tears has embedded in various different curriculums. So even the English different, the curriculums that are used in schools, there is a good blend available. The teachers' guides for each grade that are available talks about how and when with different patterns of writing or reading in school can be blended. And even for a couple of children in inclusive classrooms, where the school was going ahead, say with a 4-lined colored blue and pink notebook, we did request them to allow our child to use the black and white books that all HWT books are, so that and the double line. And once the child reaches that stage, he or she will be continuing with the school notebooks, and that was very well allowed. You need to understand, our books or HWT books are completely black and white. We know sometimes colors also overwhelm our children. They are visually distracting. So hence, a lot of these things have to be talked about. We have to be the voice of our children, talk about what's right for them, what's developmentally appropriate, what research is talking about. But there is also accommodation. There is also blending that HWT offers. Knowing all of it and working accordingly will be a chapter for success, for sure.
Thank you, ma'am. Hope your talk will help our children with the autism more, and school will be more open to accept the children's. Thank you.
I'm sure
And for
we all
this,
will.
I will go to my last question for today. As you talked about the importance of the technology in the recent era, so handwriting is the skill we use for the academics and also for the expression. But in the coming future of the digital world, as a professional, I would like to know your opinion. Is handwriting really matters nowadays? And what are the other modalities we can provide to our children?
So we have spoken a little bit about it already. Handwriting does open up a lot of cognitive areas which typing or keyboarding may not do as much. Therefore, emphasizing handwriting in the initial years is definitely required. And what I trace, what I do with my hand, the motor pattern that I make to, so we very small example that just came to me is, we talk about the joint attention and pointing in our children, in our young children with autism. So if a child points, and I as a, to build on the self-absorbed or the language patterns, as a therapist, I work a lot on developing joint attention and shared excitement. Now, if this does not develop, for example, in some children, there will be lesser chance that the child will write. Or one of the studies also shows that if there is pointing with a non-dominant hand, there may be difficulty with writing, because a lot of our children on the autism spectrum have handedness conflict as well. So a lot of these things have to be, judged and interpreted in the early years to understand where we are going. Whatever I'm saying does not really still define. These are studies, these are predictions, or these are observations, but there could always be a change. So since definitely our handwriting content has reduced in the last few years, we are preferably typing, we are using more we're using more WhatsApp, we are messaging, the pigeon letter time has gone. So there is a change, there is a big change. And of course, to be able to work on it in the initial years, to bring a person to a level where he may have to fill in forms, he may have to understand a handwritten card from his grandparents, is a basic minimum. Handwriting for children who are really struggling with it is a prerequisite skill. But if it is not happening, being open to using technology, keyboarding, many apps these days are helping children and adults on the autism spectrum to be able to communicate, is very, very openly accepted and is very functional. So I would be at the cornerstone of trying to work on handwriting in the initial many years, also being open to work on the reading, comprehension, and technology to give the ultimate goal to our children to be able to communicate, which is where technology and other ways can be implemented.
Great. Thank you, ma'am. You have answered all our queries so beautifully. And on the behalf of PlayStreet team, I extend a very heartily thanks to you and your valuable time and for sharing your knowledge with us. Also, I would like to end with the note that the topic of the today's summit is importance of relationship, movement, and consciousness for individual with autism. We all would have the witness that how difficult and frustrating handwriting is for our children, and repeated failure may lead to poor sense of competence, affecting the self-confidence of the child. I hope today we all got some more idea from Ms. Richa Kapoor about how bringing the component of relationship with understanding of sensory and motor difficulties of our children and providing the right movement and strategy to help our children to make the small successful steps every day. Thank you everyone for joining us today. Thank you.